Hi everyone, my name is Susmita. Welcome to my presentation. Let's begin with the definition of palliative care. Palliative care is person and family-centered care provided for a patient with active, progressive, advanced disease who has little or no prospect of cure and who is expected to die and for whom the primary goal is to optimize the quality of care. The entire presentation will focus on the effects of Advanced Care Plan, ACP, on a patient and family satisfaction with care, comprehensive overview of ethical decision-making concerning ACP, and requirement for effective communication in a palliative context. I'd like to define ACP. ACP is an ongoing process of communication involving patients, family members, and caregivers on one hand, and health providers on the other to establish values, goals, and preferences for future care, along with the discussion concerning end-of-life care options. Family involvement in advanced care planning helps them understand the ongoing need, expectation of disease conditions, and side effects of treatment, decreasing disputes, anxiety, and stress, hence enhancing satisfaction with care. ACP promotes patients' autonomy, which is right to make their own decision, and contributes to improving the quality of life by emphasizing on person-centered care. It is also important to acknowledge change in decisions along with change or progress in disease conditions and patients' preferences. Now, moving forward to the next slide. Autonomy, beneficence, non-maleficence, and justice are four major ethical aspects implemented for best decision-making concerning ACP in palliative patients. I would justify this with an example. A patient makes a decision to go with the treatment, but the doctor may refuse to carry out the treatment as they deem it unethical or inappropriate. In this case, all medical teams make a combined decision by having discussion with family and patient about why treatment is not applicable, though team respects the patient's autonomy by providing alternative options relevant to him. In addition, ACP plan includes no CPR and prefers to die at home, which is acknowledged by the team. Thus, the team is acting on the patient's best interest, respecting autonomy, making decisions that do not harm the patient, and providing justified care. Now, I'd like to draw your attention towards effective communication. Communication in palliative care settings can be difficult as most people are depressed, scared, and anxious about end of life. Therefore, nurses need to address their needs and concerns and advocate on their behalf for fulfilling their needs and wishes to a multidisciplinary team to promote dignified death in a professional and respectful manner. At the same time, educating families about ongoing disease conditions, use and side effects of medications, outcome of treatment, withdrawal symptoms, helps to address family concerns, emotions, disputes, and misunderstanding and maintain positive connections. Effective communication for culturally and linguistically diverse patients can be challenging. It can be maintained by developing strong rapport, active listening, trying to contact interpreters for translation, being non-judgmental, recognizing their cultural, linguistic, and spiritual values and needs, and engaging them and their families while making care plans. Documentation and proper handover is very essential. In conclusion, ACP plays a major role in patient and family satisfaction with care, along with ethical consideration in decision-making and effective communication in the palliative care settings. By saying so, I would like to conclude my presentation. Thank you so much.